Hello friends, welcome to the channel Dewdear Academy. So in this video I have uploaded the different questions. I have included the different questions for the JPHN exam preparation, that is Junior Public Health Nurse exam preparation. And if you are ready to take your preparation to the next level, don't wait. You can download your Dewdear Academy app now from Google Play Store. So if you download the Dewdear Academy app in your mobile phone, we have uploaded a course containing different practice tests for JPHN exam preparation. And also there are previous year questions. So this app makes your study sessions more productive. So just track your progress and performance through the Dewdear Academy app. So now we move on to the questions now. So the first question is, the Expanded Program on Immunization (EPI) was launched by WHO in options 1974, 1984, 1990 and 1965. The Expanded Program on Immunization (EPI) was launched by WHO in which year? So the World Health Organization, the WHO, this World Health Organization launched this EPI, Expanded Program on Immunization, in 1974 to ensure the universal access to vaccines for preventable diseases like tuberculosis, polio, diphtheria, pertussis and tetanus, that is DPT, and measles. So the preventable diseases mainly include tuberculosis, then polio, DPT and measles. So this program was started to reduce the infant and child mortality by immunizing against major infectious diseases. So the correct answer here in these options 1974, 84, 1990 and 1965, correct answer is option A, 1974. This EPI was expanded later to include the vaccines for hepatitis B, then Haemophilus influenza type B, HIB, and also the rubella and other diseases. So in India, this EPI was launched in 1978. So this EPI was launched in India in the year 1978. EPI was launched by WHO in the year 1974 and it was launched in India in the year 1978. Later it was strengthened as UIP, that is Universal Immunization Program, UIP, in the year 1985. Later this program was strengthened as Universal Immunization Program in the year 1985. Then the second question is, what is the incubation period of hepatitis A? Options are 7 to 14 days, 15 to 50 days, 60 to 90 days, 2 to 5 days. What is the incubation period of hepatitis A? So hepatitis A, the main causative organism is hepatitis A virus. Hepatitis A virus. And the transmission is fecal-oral route. The main transmission is fecal-oral route, that is the contaminated food, water or close contact with an infected person. And the symptoms include fever, jaundice, jaundice means yellowish skin and eyes, then nausea, abdominal pain, dark urine and fatigue. So here the question is the incubation period of hepatitis A. So the correct answer is 15 to 50 days. With an average we can say 28 to 30 days. So 15 to 50 days is the incubation period of hepatitis A. That means the symptoms may appear any time within this range after exposure to this virus. After exposure to hepatitis A virus, the symptoms may appear any time within this range of 15 to 50 days or in an average of 28 to 30 days. So the correct answer is option B, 15 to 50 days. And the prevention, for the prevention of hepatitis A vaccine is given. Hepatitis A vaccine is given. It is given in 2 doses, 6 months apart. It is given in 2 doses as 6 months apart these vaccines are given. Then the other method of prevention is improved sanitation and hygiene, that is the hand washing, safe drinking water. These are all the measures to improve or prevent hepatitis A. If we compare with other hepatitis types, another one is hepatitis B, and the incubation period of hepatitis B is 45 to 180 days. 45 to 180 days. And how it is spread? It is spread through blood and body fluid. So through blood and body fluid, hepatitis B is transmitted. Hepatitis C virus, another type is hepatitis C virus, and the incubation period is 14 to 180 days. 14 to 180 days. So this is also spread through blood, mainly through blood. Hepatitis C, the disease is also spread through blood. The next is hepatitis E. Hepatitis E, the incubation period is 15 to 60 days. 15 to 60 days. And the transmission is same as hepatitis A, that is fecal-oral route. That is fecal-oral route. So this is the hepatitis A, the incubation period. The question, what is the incubation period of hepatitis A? The correct answer is 15 to 50 days. Then the next question. The first referral unit in the healthcare system is, options are subcenter, primary health center or PHC, community health center or CHC, and district hospital. So what is the first referral unit in the healthcare system? So here the correct answer is community health center or CHC. So CHC is the first referral unit, FRU, the first referral unit in the healthcare system. It provides the specialist services and manages the cases referred from PHC. The cases are referred from PHC and it will be managing the cases that are referred from PHC. So the subcenter is the first contact point. The first contact point to the healthcare services is subcenter, and it is catering to 3,000 to 5,000 people. So this is the first contact point. If the question is, what is the first contact point for the healthcare services? The correct answer will be subcenter. Then the primary health centers or PHC, it provides the basic health services. It is providing the primary, or it is providing the basic healthcare services. And this can be the referral unit for subcenter. This is acting as a referral unit for subcenter. And community health center or CHC functions as the first FRU. The first FRU or first referral unit with specialist services like obstetrics, surgery, pediatrics, and also medicine. These are all there in the community health center. So FRU or the first referral unit is community health centers. Then the district hospital. So the tertiary care center, it is a district hospitals can be considered as a tertiary care centers. They are tertiary care centers for referrals from CHC. So if there is any referral from CHC, that is going to the district hospital. So in this question, the first referral unit in the healthcare system, the correct answer is option C, that is community health center or CHC. Then the next question. The best way to prevent neonatal tetanus is, options, giving the baby a tetanus injection after birth, administering 2 doses of tetanus toxoid to the mother during pregnancy, keeping the baby in an incubator, avoiding breastfeeding for 24 hours. The best way to prevent neonatal tetanus is, so first, giving the baby a tetanus injection after birth. This is not effective as a preventive measure, because neonatal tetanus occurs due to contaminated delivery practices. So if we are giving the injection after birth, it may not be considered as an effective preventive measure. Second option is administering 2 doses of tetanus toxoid to the mother during pregnancy. So that is the correct answer here. Administering 2 doses of tetanus toxoid TT to the mother during pregnancy. Because neonatal tetanus is a deadly condition caused by Clostridium tetani. It is caused by Clostridium tetani bacteria. So that will be entering the baby's body through the umbilical stump due to unsafe delivery practices. So the best prevention method is giving the mother 2 doses of tetanus toxoid or TT during pregnancy. So that will be producing the antibodies that protect both the mother and baby. So this tetanus toxoid, if given to the mother, it will be producing the antibodies protecting both mother and baby. The third option, keeping the baby in an incubator. Incubators are used for preterm or sick newborns, but they are not used to prevent tetanus. Then avoiding breastfeeding for 24 hours. Breastfeeding provides immunity mainly through the colostrum. So it is actually recommended to improve the baby's resistance to infections. So this is not correct answer. Option B is the correct answer. Administering 2 doses of tetanus toxoid to mother during pregnancy. Then there are other preventive measures for preventing the neonatal tetanus, that is clean and safe delivery practices, that is use of sterile cord cutting instruments, clean hands, proper care of the umbilical stump. Then hygienic postnatal care to avoid contamination, routine immunization of women of the childbearing age and adolescents with TT, that is tetanus toxoid vaccine. So these are the other preventive measures. Here in the correct answer here is administering 2 doses of tetanus toxoid to mother during pregnancy. The next question is, the correct site for BCG vaccination in newborns is anterolateral thigh, upper outer quadrant of the buttock, intradermally in the left upper arm, subcutaneously in the right upper arm. So BCG, Bacillus calmette-guerin vaccine, that is administered intradermally in the left upper arm at the insertion of the deltoid muscle to protect against tuberculosis, especially the severe forms like miliary TB or TB meningitis in children. So BCG vaccination is administered intradermally in the left upper arm. Intradermal injections may ensure the better immune response and local reaction formation. And if we are using any subcutaneous or any intramuscular sites, it can lead to abscess formation and also reduced effectiveness. So we are using the intradermal injection for the better immune response. So in order to maintain the uniformity, the left arm is the standard site for BCG. Globally, to maintain the uniformity, the left arm is usually considered as the standard site. If we are using the anterolateral thigh, in case of anterolateral thigh, it is used mainly for IM vaccines. Anterolateral thigh is used for IM vaccines like DPT, hepatitis B, Hib, in all these Haemophilus influenza. So in all these cases, we are using the intramuscular sites, but we are not using the anterolateral thigh for BCG vaccination. The next is the upper outer quadrant of the buttock. It is not recommended because if we are using the upper outer quadrant of the buttock, the medicine or the medicine will be getting injected into the fat. It will be getting injected into the fat, reducing the effectiveness of the vaccine. Then next is subcutaneously in the right upper arm. So BCG should be given intradermally, not subcutaneously, and the left arm is preferred for the standardization. Not the right upper arm, but left upper arm is used. So the correct answer is option C, intradermally in the left upper arm. And this BCG vaccination, it is usually given at birth or as early as possible within 1 year. So BCG vaccination is given at birth or as early as 1 year. And this is a live attenuated vaccine. BCG vaccination, it is a live attenuated vaccine which is derived from Mycobacterium bovis. So if you are administering this injection, after 2 to 3 weeks, there will be a small papule can be found. A small papule is noted. Then now we can move on to the next question. The normal respiratory rate in a newborn is, options are 12 to 20 breaths per minute, 20 to 40 breaths per minute, 30 to 60 breaths per minute, and 80 to 100 breaths per minute. The normal respiration or normal respiratory rate of the newborn. So the newborn means 0 to 28 days old. The normal respiration is 30 to 60 breaths per minute. As the infant is growing, the rate will be gradually slowing down. Newborns have a higher metabolic rate, so they require more oxygen, so their respiratory rate is faster compared to adult. So 30 to 60 breaths per minute is the correct answer. If it is going above 60, if the respiratory rate is above 60 breaths per minute, that can be tachypnea. That is known as tachypnea, which is indicating respiratory distress. That is indicating respiratory distress, or in case of infections like pneumonia. Then if the rate is below 30, breaths per minute, that is known as bradypnea. So it can be occurring if there is any central nervous system depression or any other complications may lead to bradypnea. In the case of normal, the respiratory rate for adult is 12 to 20. This is the normal respiratory rate for adult is 12 to 20 breaths per minute, and that is not for the newborn. Then 20 to 40 means that is not the correct range, and 80 to 100 will be very high, and it may indicate severe respiratory distress, sepsis, or any congenital heart problems and all. So the correct answer is 30 to 60 breaths per minute. Then the next question is, what is the safe limit of fluoride in drinking water as per WHO guidelines? Options 0.2 to 0.5 milligram per liter, 0.5 to 1.5 milligram per liter, 2 to 3 milligram per liter, and 4 to 5 milligram per liter. So what is the safe limit of fluoride in drinking water as per WHO guidelines? So fluoride in drinking water, what is the purpose of fluoride in drinking water? It is helping in strengthening the teeth enamel, and it reduces the occurrence of dental caries. So helps in strengthening the enamel of the teeth, and also it is reducing the dental caries or cavities. So the normal limit of the fluoride is 0.5 to 1.5 milligram per liter. That is the normal limit. Option B, 0.5 to 1.5 milligram per liter. So that limit is helping in preventing the dental caries or tooth decay, and reduces that risk of fluorosis. If there is a higher concentration above this 1.5, that may leads to fluorosis. If it is greater than 1.5, it leads to fluorosis. Fluorosis can develop, that is affecting the tooth development, and it can lead to staining and pitting of the teeth, and also it may leads to skeletal fluorosis affecting bones and joints. So not only the teeth, but also it affects the bones and joints. So if you are considering 0.2 and 0.2 to 0.5, the fluoride levels are low levels, and that is not effective for preventing the dental caries. Then 2 to 3 means these are higher fluoride concentrations, that is increasing the risk of fluorosis. 4 to 5 means level above 4 can leads to very serious health issues like skeletal fluorosis and severe dental fluorosis. So this is also not the correct answer. 0.5 to 1.5. 0.5 to 1.5 is the WHO recommendation of the fluoride level in drinking water. So now we move on to the next question, that is, which contraceptive method has the lowest failure rate? Which contraceptive method has the lowest failure rate? Options: condoms, oral contraceptive pills, copper T or IUD, and tubectomy. So the contraceptive methods with lower failure rate is tubectomy or female sterilization, and also the male sterilization or vasectomy. These are all having the lowest failure rate, that is less than 0.5% is the failure rate. And also we can say this is the permanent method of sterilization, or permanent method of contraception. So these are having the lowest rate among all other methods, that is less than 0.5%. Then copper T is also effective, highly effective, with the failure rate is around 0.8%, copper T. copper T, the failure rate is 0.8%. So comparatively, we can say the permanent method of sterilization like tubectomy is having the lowest failure rate. So the correct answer is option D, tubectomy. It is the permanent method and it is having the failure rate of less than 0.5%. So thank you for watching this video. I will be uploading more videos for JPHN exam preparation, and also you can download the app Dewdear Academy and you can track your progress and performance by answering the different practice test questions and also the previous year questions. Thank you.